Okay, we are going to do Chapter 9, and this is a low-tech chapter. It's got a lot of stuff in it. We're going to be doing some things in class, looking at examples of all these, but actually the material is pretty easy. We're going to look at both physical and chemical methods of control. Okay, so some terms you need. Sterilization, 100% kill. 100%. 100%. The terms aseptic or asepsis means basically 100% removal of microorganisms. Now, jump down to disinfection and antisepsis. You all have disinfectants at home. You all have antiseptics at home. Both disinfectants and antiseptics kill less than 100%. These are chemicals, aqueous solutions, and aqueous solutions do not sterilize. But they can kill a very high concentration of bacteria, but just not 100%. And the difference in the two, disinfectant versus antiseptic, is where you use them. Disinfectants like bleach and 409 are used on inanimate objects. They could be countertops, it could be floor, it could be utensils. Antiseptics are used with living tissue, on a cut, on a wound, mouthwashes to be put into your mouth. One is not necessarily better than the other group. There are bad killers and good killers in both disinfectant groups and antiseptic groups. Sanitization is the same as disinfection. Pasteurization we'll talk more about, because I don't want to go with that now. Static versus cidal. Static inhibit, cidal kill, like a bacteriostatic agent, a fungistatic agent, a virucidal agent. That's one that destroys viruses. Okay, also realize as we go through here the different methods we're going to be talking about. Some are better killers than others. So you're looking at things that are high level, like an autoclave or ethylene oxide gas, versus most of the chemicals that you would have in your house. They're pretty low level killers. Notice also that there's a difference in microorganisms and how they respond to the agent. Some things like endospores are extremely resistant, and the mycobacteria, which are the causes of leprosy and tuberculosis, are also very resistant. But luckily, most viruses are pretty sensitive and can be destroyed relatively easily. Okay, so we're going to be doing a lab on evaluating disinfectants and antiseptics. We are going to be using a disc diffusion method. So on the picture that you see over here, this white disc in the center is saturated with a chemical. First, the agar plate is streaked with the bacteria. You can see the bacteria that have grown in the background. Then the disc with the chemical is put on top of the inoculated agar plate, and the entire plate is incubated at a temperature, let's say 37 degrees. And you will notice that there is an area right here where the bacteria are not growing around the disc. This is called the zone of inhibition, and it is the area at which the concentration of the chemical inhibits or kills the microorganism. And we measure this zone from edge to edge. The larger that zone, the more sensitive the microorganism is to the chemical. That's called the disc diffusion method. Another test that you need to understand a little bit about is the phenol coefficient. So a phenol coefficient is a comparison of a chemical, the killing ability of a chemical, compared to phenol. Phenol is the oldest chemical used as a antimicrobial agent, so it's the one that all other chemicals are compared against. The killing ability of phenol is 1, and everything is compared to 1. Anything over 1, the higher the number, the more kill the chemical has compared to phenol. And anything less than 1, the lower the number, the less kill ability that chemical has compared to phenol. So you see, for example, there's phenol. Right there. There are a lot of things here that are way better killers than phenol. Even alcohol is 6 times better killer. And here's Lysol, and it's 5 times better. Notice that when they do a phenol coefficient, they compare the killability against 2 very different organisms. Staph is a gram-positive organism. Salmonella is a gram-negative organism. And you know that they have different kinds of wall structures and susceptibilities to different agents. Another way you can do it is an in-use test. I'm not going to go over that now. Okay, so here is a look at different kinds of heat methods. Let me move that up there. Okay. So, moist heat versus dry heat. The picture you're looking at up at the top right is called an autoclave. You see a picture at the bottom showing you how it works. Look at the steam pipe at the very bottom. There's some blue arrows showing you steam going into an outer jacket. There's an inner area where the media, for example, is placed. And then there is an outer area where steam goes in. We put all the materials that we want to sterilize in the autoclave. The door is closed. Steam enters from the outer jacket into the inner area where all the materials are. And once the steam goes in, the temperature will go up to 121 degrees Celsius. That's where we put it at. Will be at 15 pounds per square inch of pressure. So it's very high pressure. That's how you can get the temperature much higher than boiling. Now remember, that's 121 degrees Celsius. 100 degrees Celsius is boiling temperature. So it's the pressure that drives the temperature up. The material is autoclaved usually for 15 minutes. And then the steam is evacuated. Pressure drops down. And then we can open up the autoclave and get the material out. We autoclave all of our media in the autoclave. We also kill all of your bacteria that you use in the lab, all the tubes, all the plates, all that go into the autoclave. So 121 degrees Celsius, 15 pounds per square inch of pressure, 15 minutes will kill everything, and I mean everything. That's called moist heat. You're obviously using water vapor. Other examples of moist heat: boiling and pasteurization. Pasteurization is done primarily now for dairy products, and it's very different from these other methods: boiling, autoclaving, and ultra-high temp sterilization. The difference is pasteurization is not for sterilization. An autoclave sterilizes. Boiling, if you do it long enough, for 20-30 minutes, will sterilize. Like if you wanted to sterilize forceps or baby bottles, something like that, boiling would be fine. Ultra-high temp sterilization is an extreme high temperature for just a very short amount of time. The temperature is so high that everything is destroyed. But pasteurization is different in that you're only going for a kill of about 95%. And that's done in the food industry, particularly for dairy products. So remember, it's different from the other moist mechanisms in that it does not give you 100% kill. But again, that's good enough for eliminating pathogens from milk. Now, dry heat Good example would be an oven. Remember those baby bottles I said that you could sterilize by boiling for, let's say, 20 minutes? You could instead put baby bottles into your oven at home. Put them at 160, 170 degrees Celsius for about 1 to 2 hours. And at the end of that, you would have sterile baby bottles. The difference between boiling them to sterilize and a dry heat oven to sterilize is the time factor. The temperature of boiling is actually much lower than the oven. 160, 170 Celsius versus boiling temperature is 100. But it's that moist heat that drives, it's the moisture, the humidity that drives that heat into the object. So you get much more effective kill in a shorter amount of time. Again, both methods kill. The time is the difference. Now, ultra-high temp sterilization is for certain types of foods, particularly some types of milks. Not our milk. Much in the United States, we don't use it, but there are countries that actually sterilize their milk. We'll talk more about that in class. Here's a look at kill of spores versus vegetative cells, that is non-spore forming microorganisms, and the difference that you have to treat them, time and temperature and so on. And again, if you look at the spores, you will notice for bacteria, for example, and remember endospores, it can be upwards of 800 minutes at 100 degrees Celsius to kill endospores, whereas if you look to the left at vegetative cells, it can be as little as 10 minutes at 60 to 70 degrees Celsius. So spore structures are extremely hardy. Okay, non-heat methods, radiation. Ultraviolet versus ionizing. These strawberries that you're looking at up here, you got two batches. The one on the left has not been radiated and the one on the right has. They're using ionizing radiation. Most of the grocery stores, all the fruits and vegetables have been irradiated. There is no radiation leaking out of the fruits and vegetables. It extends shelf life. It destroys molds, bacteria, and so on. And the other irradiation, ultraviolet, which is not as effective, is used quite often for surface decontamination, like if you wanted to sterilize a countertop, or sometimes they use ultraviolet to sterilize air, or I guess those would be two good examples. The difference is, let me point out on the diagram over here for radiation over on the right. You see ultraviolet is over at the left, and unfortunately ionizing is way off to the left. Let's see if I can get rid of this other picture. Nope, I thought it was two different pictures. Alright. Well, let me draw on it then. So, ionizing radiation is way over here to the left of ultraviolet. These are much shorter wavelengths over here, so you have much better killability than ultraviolet. But again, there are some uses for ultraviolet. Okay, filtration. You can filter fluids and you can filter air. Obviously, you have to have a filter apparatus. So here's a flow hood, for example. We have one in the lab. And up at the top is what is called a HEPA filter, high efficiency particulate air filtration. Special, very expensive filter, catches viruses, bacteria, very fine material that's in the air. And therefore, the contaminated air doesn't go into the general air supply. There are some air purifiers that have HEPA filters. Also you can filter fluids, like beers are often filtered. You can also filter solutions that cannot be heated. So up at the top right picture, you see a solution right there that that is going through tubing and it's being filtered, there's a special filter right in here. It's got tiny, 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 tiny pores. All of the bacteria, viruses, blah, 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 are caught up at the top of the filter, and anything that ends up being filtered, the fluid solution, is totally sterile. There is nothing that has gotten past the filter down into the solution. So very good for heat-sensitive items. And you can vary the size of the filter. So you can see a table at the bottom here showing you different size filters. If you want to keep out bacteria, then you would go with maybe this 0.22 micron size filter, and that'll catch all bacteria. Now you may have some viruses, a few little viruses that get through, and if that's a concern, then you just get a smaller filter size. Other things you see over here that can be used: osmotic pressure. For example, honey has been used to pack wounds. Salt actually has also for probably thousands of years. Cold temperature, refrigerator, freezer, although that does not sterilize. And drying, desiccation. But again, osmotic pressure, cold temperature, and desiccation doesn't really sterilize. It can reduce bacterial growth, microbial growth, but it doesn't sterilize things. And I'll do a comparison of this in class. Okay, so let me go over to the chemicals. So here are a couple of guys that are really important in chemical control. Both mid to latter 1800s. Ignaz Semmelweis on the left, who was a doctor, introduced ways of reducing infection rates in women that were giving birth. It wasn't an infection of the newborn, it was the infection of the woman. When the placenta tore, the bacteria could get into her blood supply, particularly off the hands of doctors and nurses if they didn't wash their hands, and hand washing was not common at the time. And he introduced methods of hand washing and ways to treat patients that really reduced the death rate and the infection rate of women giving birth. Lister, guy on the right, although he did not introduce Listerine and has nothing to do with Listerine, introduced chemical usage in operating rooms. So the picture down here at the bottom right, you see what's called a fumigator, and it's spraying out an aerosol over the operating room table. There's a patient there, and that really reduced the infection rate as a result of surgical methods that were being done on patients. So, some different kinds of chemicals. I mentioned phenols already. Here are a couple of phenol agents up at the top. These guys right here. They tend to be rather irritating. You wouldn't want to use them on an open wound, but they're really good for countertops and toilets and a variety of other things. Alcohols are nice because they are not irritant. They are volatile, so they evaporate and they leave no stain and they leave no smell, although alcohols are not necessarily good against endospores. Then you've got some halogens like iodine and chlorine. Let's talk about iodine. Well, actually both. Chlorine, like in bleach, which is very effective, but again, you don't want to really pour bleach or even a dilute bleach solution into a wound. It's an irritant, smells bad, but it's really good for inanimate objects. Iodine, on the other hand, like Wescodine or Povidone, used all the time on tissues for cuts and preps for drawing blood and things like that. Oxidizing agents. Hydrogen peroxide, very good. You can only buy about 3% H2O2 at the store. That's not terribly effective, but if you go up to 25% or higher, it's a very good killer. But unfortunately, since they're oxidizing agents, they can also do damage to your own cells. Then we've got some surfactants, like the detergents, quaternary ammonium compounds. You'll see this is probably the biggest group right here. And here's an example, benzalkonium chloride. They're sometimes called the quats. You'll see quaternary ammonium compounds, If you look on ingredients of things like 409 or spray Lysol chemicals, you will see a lot of things that have ammonium compounds in them, and those are the detergents in this group. They are colorless, they are not an irritant, very good killers, so they're used a lot. Heavy metals like copper, zinc, magnesium, silver, even gold has some antimicrobial capabilities, although those are really expensive and they are not used commonly. Aldehydes and glutaraldehyde used commonly to decontaminate. And then gaseous agents like chlorine gas and ethylene oxide gas are actually the major sterilizing agents for the chemicals. These are gases, so we've got a little bit different thing here because a gas can penetrate much better than an aqueous solution. Aqueous solutions only go where you put it, like with a sponge or you pour it or something like that. You let a gas out into a room or a container, it goes everywhere, it permeates. So gases are much better effective killers. Now there are downsides to both chlorine gas and ETO in that they are toxic, so people can't be in the area where they're being used. And ETO is explosive. The container that you're looking at over here, this is an ETO container. She's putting, I don't know, it could be instruments, it could be lab coats, whatever. This thing is closed, and then the ETO gas comes in and sterilizes whatever's in there. And then it's evacuated, and then the person can open it up. Dyes can have antimicrobial capabilities, like malachite green, which is used to treat ick in fish tanks. The little white spots you see on the fish are ick. It's a fungal infection. And down below you see a kid with oral herpes or cold sores, and they've put gentian violet, which is a close relative of crystal violet, in the mouth, turning it purple. Doesn't work great, but it's very cheap, and a lot of countries still use it. And of course there are a lot of spices that have antimicrobial capabilities. They're put into foods, so breads and cake mixes and cokes and lots of different types of food and drink have antimicrobial materials in them. Here's a look at some of the different chemicals we've talked about. Again, some used as antiseptics, some as disinfectants, some maybe both. Some have some disadvantages. Didn't mean to go back there. Let me go over here. Okay. You can see some of them are very good against endospores. So look right here, and you've got some pretty good killers there. If something can kill spores, particularly endospores, it can kill anything else. Spores are the most hardy of things. But most of these other things don't really kill endospores. Some of them have irritation or corrosive effects, like phenolics. Some of them are inactivated by other chemicals. So again, it depends on what you're trying to decontaminate, what you might want to use. And here's actually a look at some different types of things, like petroleum products and textiles and woods, and what types of agents they use as antimicrobial chemicals. There is a question, this has been going on for quite a few years and it's not been answered, about whether using a lot of antimicrobials in your home, like hand soaps and sanitizers and things like that, might enhance resistance of the bacteria to chemicals. So you're actually making them more resistant. There's some studies that show yes, some studies that show no. It's still kind of up in the air. And we'll do some examples to see if you get an idea of what kind of things might be used under certain circumstances. We'll do that in class.